We're aiming for the best possible clinic that has flexibility.
The whole process seems to have been just falling forward, making mistakes, and then learning from those mistakes and going onwards and coming up with something.
So I'd like to welcome you this morning and really thank you for taking the time to come not only today and tomorrow, but every day the week of the 12th to the 16th of March for the actual big 3P process, to take us through a process that really is new to the Regina Qu'Appelle Health Region. It's a real learning experience. It's the first time we've been through something like this, and we hope that by going through this process, people like ourselves and our other colleagues can learn and carry on from here.
3P is a lean process that was designed to handle radical change, and putting 3 new service lines inside a clinic that is at the moment empty is something that fits 3P quite well.
This is very different than your typical architecture. It's a process of working on flow. You work on flow, you get how people work, and then you build the building around it. So it's a very different approach to the typical medical planning.
I was having a hard time realizing what the difference of this clinic was going to be versus the one 4 blocks that way, 5 blocks that way.
We are going to focus on the patient flow rather than what really works well for the providers, and then we will think about what works well for the providers after we've worked on the patient flow, so we get a priority that's a little bit different.
It's the first time I've really understood the lean concept, and subsequent to that, having got a good understanding, I find that as we've repeated stuff today on day 2, that I foresee that the process can definitely work.
So as we started this process, the first thing that we noticed were people talking about what is this clinic going to be. As we got the group together for the first time, the discussion was around, does anybody know exactly what we're going to do? What is this clinic going to be? And so we started to have a discussion around that, and we decided we need to start by creating a vision. So we created a vision that said we were going to be a comprehensive clinic with open access that serves a culturally diverse community with flexibility, trust, and respect.
If we walk together, we'll be able to understand each other in that way of life.
The one thing that's actually surprised me during this process is actually sitting next to patients that have been through the system and actually their input into this process and what their perspective is. I didn't really understand it initially, like I said, with the lean process, but now that I've been sitting next to patients and talking to them, and actually that barrier between the patient and physician has been broken.
You know, anybody that's working with First Nations, it would be beneficial for them to try a sweat or go to a ceremony or even talk to an elder, because you have the idea of how it is to live our way of life and understand our way of life and have that respect and have that feel of security when we're able to walk in through this clinic.
So this data that we collected over the next few days was all around making sure we understood who those patients are, what symptoms they were going to have, in what volume would they be coming through the door, and what would be the steps that those patients would be taking when they came through the door. The team of healthcare providers that are working inside this 3P project started to design the clinic without walls. So we took the suggestions of all of the people involved in the 3P, we voted, and we came down to some 2-dimensional drawings we'll see over here. These 2-dimensional drawings take all of the ideas that we had in the previous drawings and put them in the footprint of the building. So now you can start to see the building in the footprint, and we're starting to incorporate some of the ideas. The next day, the process is to build the 3-dimensional models in small scale on the tabletop. So we'll take a look at those next. These are the 3-dimensional models in the small scale. So you can see that suddenly the building jumps out at you. It's not flat 2-dimensional drawing anymore, and people were really shocked at how much different things looked.
It's been interesting how certain concepts we had on sort of paper hadn't really panned out in the 3D process, and now you can actually conceptualize the space standing in it.
walking through the entire process. We want to see where do they go when they get here for their treatment, and how far do they have to travel, and how much sense does it make? How far do our healthcare providers have to travel? And we did that for all 4 of our models. So let's take a look at how things really changed in the larger 3D model. You can see that it's very open layout. We still achieved everything that we were looking for as far as having all 8 of the exam rooms, having the right storage areas, having the right conference rooms.
Is it going to be successful as a medical clinic? Absolutely, because structurally we have what we need.
As people enter, they have a very nice flow. You can see some of these curves we were talking about in the earlier designs. You can see the curved walls. You can see that it's very easy and obvious as you walk in the door to understand where it is you're supposed to go. The reception desk is right here, it's by itself. The community liaison is right there. As soon as you walk to the reception area, you'll see the community liaison. See the family space right next to the reception area. And then as you move through the clinic, it's very open. The providers are separated from the patients, but not completely separated. They can hear each other, but they can't see each other. And they have very nice flow for the providers. They don't have offices. They have instead flow stations with the information and computers they need at their fingertips there. I'll step out of the way in a moment. This is an exam room with as much detail in it as we can possibly get. We've got the bed designed and made out of foam, but it's the right size. Sinks, cabinets, some of the supplies. So people want to be able to get a sense as they walk in here, does it really flow? Can I really do what I want to do? Can I really get in front of the sink? Are my supplies really where I want them to be? Is my head going to hit something? You know, did I put it in the wrong spot? Am I going to trip over something? Does this flow make sense? You can see the flow of moving directly to the reception area. Here's the community liaison that we were talking about being visible from the reception desk. Here's the family area. And so the key is that these are no longer waiting rooms where people come and wait long periods of time. These are family areas. This is where your family waits while you're in getting your care. The idea of this clinic is that you will come in, you will flow right through the process and flow right back out.
And I think all in all the process works very, very well. It brings a whole dynamic group of people together, and a lot of ideas that came out near the end of the week just because of the group's cohesion and people's comfort, it's made a huge difference. And some of the ideas, even from people that have no bearing on medicine whatsoever, have actually been one of the things that I've probably learned the most.